My name is Nicola Hodgson. I'm a physiotherapist from the Manchester Adult Cystic Fibrosis Unit, and my research area of interest is on muscle strength measurement, in particular clinical practice. I would like to improve how we detect muscle strength losses and prevent secondary issues related to this. So I'm going to talk to you today just about the rationale, my pre-doctoral year, key outcomes and future directions. So cystic fibrosis is a multi-system genetic condition. Patients suffer with recurrent chest infections which can lead to inflammation and scarring within the lungs. They also can suffer digestive issues which can lead to malabsorption of food. And as a growing child with CF, weight gain, growth and physical maturity can be affected. This can all lead to reduced muscle strength compared to the general population. And what we have now in CF is advances in medical management, in particular genetic modifying drugs, which is leading to an ageing CF population. So as you can see from this graph illustrates the change in muscular strength across the lifespan, and this is for everybody. What we know is that we reach peak physical capacity between our ages of 20 and 30 years. This generally remains stable between the ages of 30 and 50 years, and that after the age of 50 we have noticeable declines. What you can see from the graph is the blue line represents the general population, and the red line demonstrates somebody with CF with a sedentary lifestyle. So what we can see is that CF patients develop lower strength gains early in life, and there's a disparity between the general population and those with CF. What we also see is that between the ages of 30 and 50 years may not be relatively stable, depending on their disease severity. Repeated chest infections, hospital admissions may lead to declines in muscle strength during this time period. And these changes in strength can often go unnoticed until a point where a person suffers with difficulties performing a task or unable to do the things that they want to do themselves. So this is termed the disability threshold, and what we see after this point is that if muscle strength losses are after this point, that they can suffer with issues in terms of their physical function. It can have a negative impact on their quality of life, can increase risk of falls, lead to changes in morbidity and mortality rate, and contribute to healthcare costs. So the problems that we have is that there is a lack of whole body muscle strength measurement in clinical practice, and we don't know what patients think of this, what are their experiences and what are their opinions regarding this. So therefore, during my pre-doctoral year, I completed a scoping review looking at how muscle strength is measured in the general literature. It was a broad review looking at muscle strength. The protocol for the scoping review was published on Open Science Framework, and it followed the JBI principles of scoping review. The searches were conducted, the results were screened and data was extracted. The data that was extracted was on the strength construct, the assessment measured used, in what population, in what setting and in what country. So it was a very broad scoping review. There was 209 studies were included. What we found was that whole body assessments were rarely used in clinical populations, but the mid-thigh pull test was mostly used. The bar graph here shows the strength measures that were used in cystic fibrosis. So the most tests that we used were the one repetition max test and the hand grip test. But as you can see, the mid-thigh pull doesn't appear in this chart. There were also lots of functional tests that were commonly used. I also conducted some patient and public involvement. This involved 2 discussion groups, one using patients from the cystic fibrosis group. So these were patients from different CF centres across the UK. and also one using patients from my CF centre. So this is quite a busy slide. Just on the right hand side just shows some of the key themes that came out of those discussions, but I'm going to talk to you about the left hand side of the slide. So there was about 11 patients that were involved, and there was a general equal mix of male and females involved in a wide age range. And some of the things that came out of this discussion was that patients communicated a change in their focus from survival to thriving now that they were receiving modulator therapies, and that there was a growing concern with regards to muscle strength with this increased life expectancy. Particularly with one participant expressing that having had long-term steroids to help with their chest, they were concerned about their muscle strength going forward. And another patient who had recently undergone some treatment for their muscle strength, how this had impacted on their quality of life. So some training and outputs. I plan to publish the results of the scoping review. The scoping review was quite large, so we're using the Shiny app and to create an interactive web page to consolidate the findings of the review. This will be useful for clinicians because they will be able to search for their population group or strength measure. They'll be able to see what was used and the key references that was linked to that. I've started to write a PhD application, and as you can see, I've undertaken quite a lot of training as part of my pre-doctoral year. But I've also had some informal learning in relation to this. So I've increased my research methods knowledge, increased my knowledge around muscle strength testing. I've had experience of managing a large data set and developed some very limited Excel skills, as my supervisors will attest to. I've had a very large supervisory team from two different universities and different professional backgrounds. This has provided me with a wealth of knowledge, but also some difficulty with navigating opinions and finding my way. So for the future, I hope to apply for a DFCAP application looking at the clinical utility of the mid-thigh pull test, in particular the reliability, the validity and the feasibility of this test in clinical practice. I would like to say a huge thank you to my supervisory team, Dr. Peter Goodwin and Dr. Nick Dobbin from the Manchester Metropolitan University, and Dr. Jodie Ventry and Amelia Parchment from the University of Manchester. I would like to thank the ARC-GM for the opportunity and the time that it's afforded me. I would like to thank the library staff at the University of Manchester and the Wythenshawe Library for their huge help with my literature searches, and the patient and public contributors, and the CF Trust and CAPRA, who provided funding for my PPIE work. Thank you.